This episode of the Beauty by ABIC podcast is brought to you by Candela Medical. Hello and welcome to the Beauty by ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we are strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is Beauty by ABIC. I'm your host, Stephanie Miller, and today's guest is Professor Firas Al-Niaimi for Candela Medical. Professor Firas is a highly experienced consultant dermatologist, cosmetic and laser expert with over 15 years' experience and an international standing. He has trained in some of the UK's leading hospitals and currently holds an honorary consultant position at the world-renowned St John's Institute of Dermatology and at Guy's and St Thomas Hospital, where he completed an advanced fellowship in dermatologic surgery and medical lasers, followed by advanced training in various centres in the USA. He has a passion for education, research and science and has contributed to over 150 publications in dermatology and lasers, making him one of the most prolific and well-published consultant dermatologists in the UK. He has delivered more than 200 scientific presentations around the world where he is regularly invited to speak, in addition to contributing several chapters of renowned books before writing and publishing his own. Here to discuss the latest and most innovative approaches to treating aesthetic scars, for Candela Medical, we welcome Professor Firas Al-Niaimi. Welcome to the podcast, Professor Firas. It's such an honour to have you here with us today.
Thank you very much. Thank you for having me.
Well, Professor, you have such a vast knowledge and extensive experience in the medical aesthetic discipline. And even briefly looking over your resume of achievements, you can clearly see there's so much passion you have there for your work. And we're all very interested. Can you tell us why you chose aesthetics in particular and all about your journey in entering the field?
Yes, I mean, the journey wasn't something that was decided from very early on, I must admit. So during my medical education, when I was at university, I actually had an interest in dermatology just because of the way it was taught, how we reach a diagnosis. It's a very varied specialty, and it's also a very visual specialty. And the visual aspect of the disease that attracted me in the first place to dermatology. And it wasn't until toward the end of my residency training in dermatology. So I trained in the UK, United Kingdom. The training there is 4 years, and it's really in my last year of residency that's when I started having the laser clinic attachments and started having a lot of interest in lasers and also procedural dermatology, doing procedures such as surgical revision. Then I went on to do a full year fellowship in lasers and also surgery, skin surgery at Thomas Hospital. That's when I really fell in love with lasers. And then when I moved on to private practice, obviously the bulk of what I do is lasers, and that attracted also the aesthetic component because there is a lot of overlap between some of the medical laser procedures and the aesthetic laser procedures. And that's how it actually all started. So it started with a passion for dermatology, an interest into lasers, a fellowship training in lasers, which was initially predominantly the so-called medical lasers, so it's more laser treatment for medical conditions, such as birthmarks, and then branched out to aesthetic dermatology, aesthetic lasers, and that's how I ended up today like what I do, which is a bit of everything, really.
The world of lasers is so appealing because it's just such a multifaceted modality. We can use it in so many ways and on so many different concerns and skin diseases as well as aesthetics. But we today, of course, are going to be talking in depth about aesthetic scars, a topic which I'm sure we can all relate to on some level. And also, some of us may have some experience in actually treating scars as well. So, aesthetic scars in general, they can be quite difficult to treat. Let's dive straight in, especially when we're talking about deeper dermal scarring, from acne or stretch marks or even surgical procedures. Can you tell us, in your experience, why this is?
Well, I mean, the reason why these scars are very difficult is, first of all, there is a damage to a number of sites within the skin. So you mentioned the dermal aspect, but the dermis is also comprised of collagen fibers, elastic fibers. Then we have the fibroblast, and then we have the sebaceous gland, and we have the hair follicle. And actually, often with scarring is that you have extensive damage in many areas of the dermis. So it's not just confined, let's say, to the collagen. There's destruction of the collagen. There is damage to the elastic fibers. There is damage to the fibroblast and the hair follicles. And with that, we don't really, till today, have a wound healing process or a wound healing mechanism in place that can repair everything perfectly. So there is extensive damage, but we don't really have a repair mechanism to repair and undo all that damage. We have come a long way, and we certainly have very effective treatments, but we still have the limitation. So it's really the extent of the damage, and also the fact that we don't really have a treatment that is perfectly aimed at wound healing repair that repairs all this extensive damage.
Do you think we will have one in the future?
Well, this is what we are hoping. We've come a long way, especially now with the use of fractional lasers, where we now have a discrete wound healing in the scar tissue that remodels the scar and almost gives it the appearance of normal tissue. But we still have some limitations for very deep scars, for example, and scars in skin of color, because as part of the healing mechanism will also lead to increased pigmentation. So sometimes that is a bit of a limitation. There is obviously ongoing work on this subject because of its interest. It's a very interesting subject, and it's a very relevant subject. But we're not there yet.
And do you think the future is in lasers, or do you think it's a multimodality approach in really having that complete solution?
I think it is going to be a multimodal approach. I think lasers do a fantastic job, but they have their limitations. I'll give you one example. If we talk about aesthetic scars, one of the common scars that we have is acne scars on the face. So acne scars on the face, sometimes that is associated with a bit of volume loss, mostly fat loss, fat atrophy. So you can actually observe in the cheeks or in the temples, you can see the scars, but you can also see that there's almost like a volume loss. The fat and the scar is completely melted. Now, that is something that is difficult for the laser to fill, because what we're trying to do with the lasers is we're trying to stimulate collagen, we're trying to improve on the quality of the skin through the wound healing, but it's very difficult to replace a large amount of volume loss, and therefore you will need something like fat transfer or some filler replacement. So this is just one simple example of a multimodal approach, and I think we're not going to have one single treatment modality addressing all issues and concerns with the scars.
Absolutely, I have to agree with you. I've seen some amazing work with a multi-modality approach using fillers or using TCA peels and lasers in combination with each other, and even low-level laser and cold laser therapy as well. There's so many amazing technologies out there. But tell us, Professor, what are the most common types of treatments that you use for aesthetic scarring right now?
I mean, the most common aesthetic treatment I use for aesthetic scars remains the laser treatment, and in particular the fractional laser. So the fractional laser essentially is a type of laser where the laser beam, the light beam, is being fractionated into very small beams of light with high energy. Now that again depends on the type of the machine that you're using and the settings that you choose. But in essence, the word fractional comes from fractionate. So you fractionate the beam of light, so you are able to dictate the depth how deep you want to go, because some of the scars can be deep, how much heat you want to put into these columns, because ultimately that's going to lead to some tightening and some heat-induced injury, wound injury, that will ultimately lead to collagen remodeling. That's our main aim when we use fractional lasers. Of course, I do other modalities such as excision, which is cutting of the fibrotic strands, the deep fibrotic strands underneath the scars. As you mentioned earlier, I do some filler placements, I do some TCA on the superficial scars, but the bulk of the work remains the fractional laser technology.
Oh, that's wonderful. It's so great to hear that there's, such a diverse technology there that can kind of really form the basis of what you're doing. And then you can go in with other modalities and other devices and so forth and finish the procedure. But no doubt the bulk of the work does get done by that laser. Let's talk about the age of the scar. Does it actually matter when it comes to the treatment approach?
Well, this is a very interesting question. And the answer is yes. And that is something that we relatively recently learned from research and from trials, in that if you look at traumatic and surgical scars. So once again, let's make it simple for the audience and classify the different types of scars. So you can have a traumatic scar. So let's say you're involved in an accident and you have a cut, or
Yes.
you're hit by an object and you get a dent and a scar. So that's a traumatic scar. If you have a surgical procedure, then you will have a surgical scar, but you can also have a burn scar, and a burn scar can be thermal, so it could be from fire. It could also be a chemical burn scar. But a lot of research that was done on traumatic and surgical scars has shown that early treatment, when the scar is young, gives us much better results compared to old established scars. So the answer is definitely yes, but that doesn't mean that old scars can't be treated or cannot respond. But when you treat a young scar, a scar early on, you do get faster and better results.
Okay. And do we know exactly why that is, that newer scars respond so well?
Yeah, I mean, that partly has to do with the wound healing process. And the wound healing process goes in different phases. And in the early stage of the wound healing phase, you have growth of blood vessels, but you have also activation of one particular cells called the fibroblast that actually produces the very thick collagen, which is the very thick scar-like tissue. So when you're treating with lasers early on, you are able to modulate, control, and subdue some of this exaggerated response to wound healing. So ultimately, you get a scar that is less red, less thick, and less hard, because you manage to skew that wound healing. Whereas when you have an old established scar, you have formed the very thick vessels, you have formed very abnormal thick collagen bundles, and what you're trying to do then is trying to break them down. And it's much harder to break established thick scar tissue than actually preventing it from happening. So it all has to do with the wound healing phase.
That makes so much sense. And so let's switch then gears back to devices. What kind of aesthetic scars can you actually treat? Because we know that you're a very big proponent of the Candela devices. Which can you actually treat with the Candela's Nordley device? And how does that sort of work?
Yeah, so I mean, I have all the Candela devices, and it's one of the best laser companies,
Oh, they
because
certainly are.
they have a very diverse portfolio, and they invest a lot in clinical research, which I think is also very, very important, because this is how we get our data and how we can get the relevant knowledge. So the Nordless is a platform that has a multiple handpieces. It has the IPL handpieces. It has also a vascular handpiece for it's called the NDAG. But what it also has is a unique handpiece, which is a fractional, but it's a non-ablative. And what we mean with non-ablative is that if you think about these fractional columns of light that I talked about earlier on, they can either melt away tissue, which we call vaporization or ablative, where you get actually visible tiny little microscopic holes, so you get the oozing and the crusting. But you also have another type, which is called the non-ablative. That means the columns of light just generate columns of heat that goes deep into the scar, but doesn't remove part of the tissue, so the wound healing is faster. And that handpiece, which is the Frax 1550, is the fractional non-ablative handpiece of the Candela Nautilus device. And I use that a lot, and that can be used for surgical scars. So that is a scar after a surgical procedure, traumatic scars, as well as facial acne scars.
And how soon after a procedure, you're talking about intervening quite soon, but you would be intervening with a heat-based modality quite quickly after a procedure or after an intervention?
Yes, I mean, but we're talking about controlled heat, and we're talking about a controlled wound healing, controlled heat, because you don't want to have excessive heat. But these fractional technologies have controlled heat and controlled wounding. And we talk about literally within the first month, so usually after a couple of weeks.
Really, that quickly?
Yeah, that's quickly you can. So obviously in this case, we're talking about the surgical and traumatic scars. Acne scars tend to evolve very slowly, but we know also that the earlier you treat, the better. But yeah, it's pretty much from week 2 to 3.
So the healing process has then started, and you
Yes.
quickly intervene with the laser to be able to lay the correct type of collagen in the correct way, so that you're intervening with that over exaggerated response. That's the theory behind it?
Exactly. So if you look at, for example, a classic wound, as classic, let's say, a surgical scar that doesn't heal well, what you will see is that after the first couple of months, it's very red, and then it starts to slightly become more raised.
Yes.
Let's say after month 4 or 5, it's more raised, and maybe some of that redness is starting to settle, and it's turning white and solid. And that is the evolution. That is the evolution of the scar tissue from that wound healing that passed the stage of making new blood vessels and promoting all this thick collagen, and now you have this thick band of collagen, which is a fibrotic scar. So when you're treating early on, you prevent that from happening. You modulate the blood vessels, so you try and keep them small, and because again, these blood vessels are feeders for this abnormal tissue. You deactivate these very abnormal cells called the fibroblasts that actually produce this thick collagen fiber, which is essentially the scar tissue. You deactivate that, therefore you reduce the production of the collagen fibers, and therefore you have less thick scar tissue. So definitely early intervention with laser treatment has its advantages, and it all has to do with how we heal after a wound.
It's really amazing, because traditionally, I mean, I started 22 years ago, and that wasn't the consensus a long time ago. But now it's definitely much more known that going in early, but going in, up to 2 weeks, obviously is quite, I think it's quite revolutionary, going in there that quickly and being able to do that job. And obviously it's got a lot to do with the changing technologies over the years, because we wouldn't have been able to do that many years ago. Now with the Nordley device and others like it, I think it allows for that quicker intervention.
Yes, because the fractional technology has just been around just for over 10 years. Probably about 12, 13 years since we have the fractional technology. Before the fractional technology, we couldn't do that. But also there's been a spike in interest in clinical trials and research studies. And again, this is very important, because this is how we get our data, and this is how we get our knowledge from. And this is why I respect a company such as Candela, because they invest a lot in these studies and these clinical studies, and this is how we will be able to get this data that we can help patients.
Absolutely. And even let's drill down a little bit more into that. How does the selective waveband technology differ from the broadband IPL when it comes to the Nordley device?
Yeah, so once again, coming back to this Nautilus device, the Nautilus is a platform, as I say, and it has multiple handpieces. The one that I just talked about in terms of scars is the fractional handpiece, which is the Frax 1550. That is the wavelength. The 1550, that is the wavelength for non-ablative fractional laser remodeling like what we use for scars. But the Norris platform also has some IPL handpiece, and that really is a fantastic IPL because what typically IPLs do, and they differ from lasers in that they give you a range of wavelengths. So they'll give you a band of wavelengths. So it's not a single wavelength. So for example, typically let's say if you use a 560 filter, in an IPL, that means they will have some from 560 all the way to, let's say, 1,400 or 1,500 meters. So they have this broad band of wavelengths. But that is unnecessary because when we are actually using the IPL, for the vast majority of cases, we are either using it for things that are red, targeting blood vessels, or targeting pigments, which is brown. So we're, put it very simply, we're either targeting red or we're targeting brown. And that's important because when you're targeting red and brown, you don't need all that excessive broadband wavelengths. Because if for the wavelengths up to 950, up to 1000 nanometer, that's the wavelength band that you need for anything that is red and anything that is brown. Because beyond that, there's hardly any absorption of these wavelengths to the red and the brown. And all you're going to get is absorption by water, which is irrelevant, and you're just going to generate heat and waste that energy. So the selective waveband technology essentially means that you have a narrower spectrum of the waveband that you have in the filters of the IPL. So for example, one of the filters starts from 530 nanometer to only 750. And that is very, very good for targeting red and brown only. And the other one is slightly longer, which is from 555 to 950. And again, it's very good for red and brown, but perhaps for the slightly darker skin types and for maybe some of the deeper vessels. So very selective to the red and brown, very little absorption by water. The skin is composed of 60 to 70% of water. So we don't need that excessive absorption generating unnecessary heat.
In addition to the incredible education and knowledge shared in today's conversation, what sets Candela apart is their commitment. From the day you become a Candela customer, you experience a true partnership. With the purchase of a Candela device, you receive a 3-year service warranty, clinical training for you and your team, as well as access to their comprehensive marketing resources. Your success is their success. Find out more at candelamedical.com.au.
So basically, the selective waveband technology means it's selecting the correct band of wavelengths for what we are intending to treat, and that is the red and brown. And that's why it's so efficient.
That's really quite ingenious and also so much safer, more targeted, safer. I can imagine the results would be so much better given that there's less heat absorption, as you were saying, in the water, and therefore it's less traumatizing, it's less traumatic.
Yes, and all that heat that you emit is only absorbed by the red and the brown where it matters. So with traditional broadband IPL, part of that heat is going to be absorbed by the red and brown, but a good chunk of that heat is going to be wasted or by the water. And this is why it will heat up the skin a bit too much, and you need a lot of cooling for it. Whereas this narrow band, selective waveband technology means that you're only going to have the heat absorbed by the red and brown, but there is no excessive heat because there's no water absorption, and therefore much more efficient.
And you reach your clinical endpoint without causing superlative trauma everywhere else in the tissue. It's actually quite, as I said, quite ingenious. I can see why you love it, why you love that particular device.
Well, I mean, I love it because it gives results. And when you give results, that means patients are happy. There's nothing better than getting that feedback from patients. So, a device, you can fall in love with a device because of its ergonomics and because of, its sophistication and what it can do. But in this case, it really delivers results. And that's what matters, results to the patients.
Absolutely.
And patients,
Absolutely.
very, very happy.
Oh, it sounds like you're very patient focused, which is so wonderful. I mean, we love the science, we love the technology behind it. We all love playing with gadgets and lasers and tools, but underneath it all is, your deep, profound wanting or willingness to help your clients and your patients. So that's beautiful to hear. And also, you're such a resource in the education world for all of us. I know for me, and for everybody, I suppose you speak through Candela and you educate through Candela as well. But, many therapists are going to be listening to this, many business owners and doctors and as well, and aesthetic nurses. And so we would love to just pick your brain a little bit more. If you could give us your advice, I suppose, of the top 3 tips that you would give us for treating aesthetic scars, what would they be?
The 3 top tips were going to be use a fractional laser. We talked about what fractional lasers can do. I think then understand the type of scar that you're dealing with.
Mm.
So if you have an acne scar, rolling scar, you may want to do a bit of subcision. So that is a procedure that can be quite specialist, but again, it doesn't have to be too advanced or too dangerous. In some of the areas, for example, in the mid cheek, you can just subcise underneath the scar, or if it's a raised scar, perhaps just inject a little bit of steroid, flatten that alongside the fractional laser, and then don't forget some of the additional treatments that you can give, and that is the growth factors, for example, the peptides, the skin, the platelet-rich plasma, or sometimes just a little bit of filler replacement afterwards. So whilst it's difficult because every scar is different, but my best tip was going to be combination treatment. And if I would say 3 tips, that would be think about whether the scar needs to be subcised first or injected. Fractional laser is going to be the second tip. And the third tip is don't forget the nutrition to the skin. So your peptides, your growth factors afterwards, they are important too.
Would you say needling them in, injecting those? We have all sorts of boosters nowadays with peptides in them, and non-cross-linked HA with all of those wonderful nutrients in there. Would you say go in and inject it in, use it superficially, or a combination of the 2?
So that depends on the type of laser that you're using. If you're using a fractional ablative laser, so that is a fractional laser that actually creates tiny little open wounds, then you can just rub it in because it will get through the skin, so you don't need to actually inject it yourself. Whereas if, for example, if you're using the Norlis device, the fractional non-ablative, then you can just inject it in. And what some do will just use a little bit of microneedling and then just rub it on top. But you can also just use a little needle and then just inject it.
Wonderful. And you were talking about steroids and injecting steroids in the area. Would you do that close to the actual laser procedure? What's the protocol with using lasers and also steroids?
Well, so steroid injections will only be reserved for the raised thick scars.
Yes.
The hypertrophic or the keloid scar. So only for the raised parts and thick scars, injecting just a little bit of amount of careful steroid injection can certainly help flatten it. And then, there are a couple of ways of doing it. You may just want to first inject, maybe the first treatment, just inject, and then see the patient, let's say 2 to 3 weeks afterwards, when you have some flattening and softening of the scar, and then you can proceed with the fraction laser. So that would be appropriate for patient who perhaps wants a very gentle approach. It's not rushed on time and just maybe wants to first see the effect of the steroid injection. The second way is probably the more common way and the way that I actually do it. That is doing the laser first and then finish off with the steroid injection immediately afterwards.
Oh, wow.
In the same session.
Wow, that's great. That would be Very impactful, I can just imagine. Would you get faster results doing it the second way?
Yeah, you do. You do get synergism and faster results. You do. There are occasions when you have a lot of thickness in the scar that you actually want to perhaps just delay the fractional laser, because
Right.
you will get better results when you have some flattening and not a lot of thickness. And part of that is also the what we will call the skin tissue interaction, and how the laser columns will penetrate deep into the skin. So for the very thick ones, there is the argument of perhaps trying to inject first and see if you can get a degree of flattening before you move on to fractional laser. But certainly for the sort of like the low to medium thickness scars, you can combine both in this.
I think the message I'm hearing is over and over again is using that global approach, using combination therapies, thinking outside the box, really thinking about, each layer, what type of scar it is, what you're trying to do and what you're trying to achieve, and then putting all those wonderful modalities together to achieve that end result.
Absolutely. I mean, 100%. And I think this is very important. This is probably the most important educational point. And that is, there is no one single modality that will address all aspects of the scars. And yes, fractional technology may sound to some almost like magic, as a very promising feat. And fractional lasers have come a long way, and they certainly have a place in scar management, but you still have to do combination treatments. And, a very, very simple example, to put it in perspective, is facial aesthetics. I mean, we can't just rely on, let's say, the toxin anti-wrinkle injections. We can't. They do a great job, but where you have volume loss, you will need the filler. And again, you can't just rely on the fillers, because where you have dynamic lines and wrinkles, you need wrinkle relaxing agents. And even if you have the two, if you have some brown spots from sun damage, you'll need a laser or a chemical peel to get rid of them. So, we learned from facial aesthetics is that there is no one size fits all, and you need to have a multimodal approach, because you have just different background of treatments and different reasons why we have differences in the scar tissue or aesthetic appearance.
And with regards to the skin quality, do you think that makes a big difference? As younger, thicker skins as opposed to older, quite thin skin. Does that change your approach slightly when you're using the lasers and the multimodality approaches?
Yeah, I do think, yes. And this is more from clinical observation, so from my own personal experience. I do think that the very mature, older skin that is drier, that has less number of fibroblasts and less active fibroblasts, which are the key cells that a lot of time we are actually targeting when we're, for example, using fractional lasers, because we're trying to stimulate these fibroblasts to activate and work and produce more collagen. And obviously, in a mature old skin, you have fewer numbers. So the younger skin is likely to respond better. That's not necessarily always the case. Yes. So that's why. This is why coming back to skin nutrition and strengthening the skin or improving the skin health is very important too. Because in the old mature skin that is dry, I like to, for example, rehydrate the skin and improve the quality of the skin with these peptide growth factors, but also with this low molecular non-cross-linked hyaluronic acid to improve on the water content. And what I tell patients is I want to revitalize the skin. I want to wake up the skin, improve the skin quality. And when you have better water content, you're also going to have a better tissue interaction with the fractional laser, because these fractional lasers rely on tissue water for their interaction.
Of course.
So it makes sense that when you have better water content, that you're going to certainly have a better result.
That's marvelous. I'm so glad to hear that. So you would actually, for a more mature skin, you would put them through a skin, I suppose, nutrition program, or do some treatments that actually stimulate that skin, make it more hydrated, make it more youthful, more resilient first, and then you would go in and treat. That's genius.
Yeah, absolutely, particularly the case for facial skin. I mean, if you're treating a scar, let's say on the elbow, then perhaps less so. But if you're treating acne scars or treating facial scars or treating the face in general with these modalities, whether in the context of scarring or the context of rejuvenation, then definitely skincare and skin health is important too.
It's been a real treat having you here today. Thank you so much, Professor, for joining us. It's just been very special, some great insights in this conversation as well.
Well, thank you very much for having me, and I'm very pleased to hear that this has been useful to your audience.
Absolutely. Thank you so much.
Thank you very much. Have a good day.
You've reached the end of another episode of the Beauty by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.